Right. That's wonderful. So tell us more about what actually is Care Patrol. What do you do? What services are there? So when somebody's listening to this, they get
Mhm.
it right away. It's like, oh, yep, when I'm in need, this is who I'm going to call.
Well, I'll give you some scenarios. I think that'll help illustrate it best. It
Great.
could be that an adult child comes back home from out of state and notices that maybe their mom or dad is starting to struggle. Things around the house are kind of falling apart. Maybe bills aren't getting paid. Maybe the fridge is empty, or there's some confusion, some cognitive change that they're noticing, and they really think they need an outside person to come in and help them understand what what are the options, what can they do to kind of help bridge the gap between the person who's living at home and what their needs are. And oftentimes that is going to be a transition to senior care, but sometimes we're able to make recommendations that include having help come into the home or just arranging maybe some transportation, that kind of thing. um, so, one thing that I'm always struck by is the financial side of this and how much we need to talk about that and plan for that. And so that's a big part of our discussion as well, because when we start talking about senior living, it isn't inexpensive. And so it's really important that you understand all your options. What ways are there to pay for care? That's another thing we spend a lot of time with our families on, and maybe what programs or opportunities are out there to help pay for care as well. So another scenario is, and this is honest, unfortunately, a lot of what we do is acute crisis. So we receive a lot of referrals from the hospitals or the inpatient rehab facilities here in town, or the primary care physicians' offices, and maybe it's gone beyond. We need to know what it's going to look like when the time comes to the time has passed. We've got to make a decision now. And we can shine in those situations because we can move very fast in helping families get up to speed as quick as possible so that they can make quick and informed decisions. But ideally, having time to educate so that, we can have preparation in place ahead of time would be our ideal situation.
Mhm. And I know from personal experience, there's a few things. I've had elderly neighbors. I've got one in her 90s that I just adore, my friend. And I know and she lives independently.
Mhm.
So going into different surgeries and then rehab and all of that,
Yeah.
whoever her doctor is, and then whatever the hospital, all they do is say, okay, you need to go to rehab, and they just give you a list. They didn't give us a anybody to help with resources or anything. So are you saying that some of the hospitals now
Oh,
might bring you,
yes. Hmm.
because that's
Yes.
something that didn't
I was at the
happen.
hospital yesterday. Yeah. My team's there right now. So, yeah, we definitely, we've made inroads. I think the biggest challenge is when I describe to people that I'm a placement agency, I oftentimes get a blank look
Yes.
because we don't change tires, we don't make donuts. People don't know we even exist out there. So, our job is to talk to great people like you and try to get the word out so that if you have a friend, a neighbor, or another member of your church that you see struggling or needing some assistance and getting some questions answered, connecting us so that we can answer questions and help bridge that gap of knowledge and help people really figure out what they're going to do. I think whether that be now or a plan B for the future.
How far in advance should they contact you if they're getting older and maybe they don't have quite the ability that they had, but yet they're still independent, but
Mm-hmm.
maybe not quite as much. And I know, like, another personal example for me is my dad is older, and he is now selling my childhood home that I've the only one I've ever known. So I've got mixed feelings about that. But he's going to go into a condo.
Uh-huh.
I know nothing about it, but I'm like, hey, you do what you need to do. And so he's going because the house even though he can live independently in it, they're still mowing the lawn and when the furnace breaks and shoveling snow and all kinds of things. He doesn't want to do that anymore. He wants everything else kind of
Hmm.
handled. So for him, again, he's still independent. He doesn't need an assisted living just yet. And this is his choice. So how far in advance should they contact you, and what does that mean or look like when they do?
Well, we find that the adult children or even a neighbor are contacting us ahead of the senior themselves. And I think it's because sometimes people are afraid if they talk about a potential that could happen, that's going to manifest it somehow. And it really doesn't. Talking about it ahead of time doesn't mean it's going to happen, but it gives you peace of mind because then you know what to expect in terms of what various options look like, what they cost. I think a lot of times we work with people typically 75 to 100 years old, and a lot of them remember the nursing homes of 40, 50 years ago. That's the
Yeah,
sights, sounds, and smells of a nursing home, right? And it's a terrifying proposition. And I think that's what creates a lot of that reluctance to reach out. But today's assisted living or independent living is not the nursing homes of 40, 50 years ago. I mean, it's vital. There's lots of activities. There's access to transportation, great food. They don't want people to leave because of food. So you've got chefs working at these communities, not, you know, sludge
right,
slingers, so to
right.
speak. So
You're
yeah,
not
there's a
getting kids
lot of
approval out
great
there.
aspects of it. Yeah. And taking over things like housekeeping. Yeah. So there's a lot of great benefit to it. So I'd say as soon as somebody's curious and thinking they're seeing some changes or seeing some changes in their neighbor or their loved one, that's the time.